Hi, it's Dr. Pavanka. I wanted to talk a little bit about going to the behaviorist with your dog. So there are some things that you sometimes come in for that are more behavior oriented than medical. So it's kind of like if you go into your general practitioner for you and you start talking about depression, anxiety, things like that. We do see anxiety disorders in our animals too. So every once in a while we'll kind of look at the case and say, okay, let's try X, Y, or Z. And I wanted to go over the difference between a trainer and a behaviorist, especially a veterinary board certified behaviorist. So trainers are amazing. And I think the best analogy I've ever heard for this situation was that your trainers are kind of like your regular school. So you go, you get your training, you know how you're supposed to act in public, you know what's expected of you, you know what you can do. That's what our trainers do. They go ahead and they can sometimes help a little bit with behavior, but it's like going to your guidance counselor and asking them things. It's not necessarily going to a doctor. The veterinary behaviorist is more like your psychiatrist or your psychologist. They're going to look and see what medications you potentially need and help with the more detailed things. There are some trainers who work closely with veterinary behaviorists. Those are amazing because they can go ahead and they can kind of get the best of both worlds. But a lot of times if we're looking at like jumping on people and milder things, we're talking more trainers. And if we're looking at like severe separation anxiety, issues with like resource guarding, having problems with strangers, having problems with other dogs, you're talking more veterinary behaviorists because they can help with the medication side and help with the more in-depth stuff. But we do recommend both quite frequently. Sometimes I'll even have you start off with the dog trainer first and then kind of work up to the behaviorist depending on what we're seeing. I am okay. A lot of times I'll tell people to go look at some of the training articles and training videos. I do like to send people to Journey Dog Training. Kayla Fratt, who started that to my understanding, actually went to high school with me. So I do recommend that one quite frequently because I've read a lot of their articles and I do like a lot of the approaches that she has to a lot of these training problems and behavioral issues. But I would say at the end of the day, if you're having more than you can deal with a regular trainer or going in self-training, then that's when you need to go get that help and maybe see the behaviorist. A lot of the training is kind of training us too. So I will say that I'm a big proponent for making sure you're there during the training, just because I want to make sure that one, you know what your trainer is doing for training, two, that you know how the dog's being trained so that you know those cues and you understand the dog kind of understands your language too, because a lot of that is that communication, that bond between us. I will say that I've definitely had trainers who did things with my dog that kind of had me flummoxed and a little bit surprised. I had one in particular who tried to drag my dog by the choke chain. I'm not a big fan of choke chains. I'm one of those people that I have the gentle leader, the head halter on my dog, just because I do like a more natural approach with a lot of things. That said, if you use those tools correctly, it's kind of the same thing when we talk about bits and bitting with our horses. Some people like bitless bridles and hackamores. I have to say I use that in my older horse a lot, but I will also use bits depending on the situation. But it depends, the tool depends on how you use it. So I've seen people, horsemen who are phenomenal horsemen, use really, really big, severe looking bits, but they treat that horse's mouth like it's made out of glass. So it's more for very, very light cues than the cues that we would think. The same thing kind of goes with our more harsher training tools. It really depends on how you use them. I personally don't like them because I think they're harder to use in a positive way. So I do go more for the head halter and things like that. I do like it when you clicker train, but it's one of those things that really depends on what works for you and your dog and what your mentality towards training is. At the end of the day though, I would make sure that you're there for training and that you recognize when you need to progress to that veterinary behaviorist and potential medication, because sometimes that medication can help so that you can get to the point where you can work back down. Some dogs need it for life. So it really depends on your dog. Everything is kind of more dependent on the individual and the lifestyle and what we can do with them. So do let me know if you have any questions, but that's kind of my general, very, very blanketed trainer versus behaviorist. A lot of times if you come to us as the veterinary clinic, we'll kind of give you an idea of what we think. But it never hurts to get a second opinion with things, and it never hurts to reach out and see if there's any help that you can get with those things. So don't be frustrated, do reach out. A lot of times I feel like we do see people at the brink of frustration where they're done. So do let us know if there's anything we can help with. A lot of times it might be saying, hey, you know what, these are our list of trainers. If you don't mind checking those out, we think you might find somebody that you could work with. Do let me know if there's any questions, but we are all set to go. Apparently I'm going into to exam room mode. Take care. Bye.